So your opioid overdose patient, whether it's accidental or intentional, kind of presents in the same way. Some of the very classic signs: pinpoint pupils, a respiratory drive that is decreased or absent, the skins might be pale, and they also usually have a normal pulse rate. The big thing to key in here is the respiratory drive. We can fix any respiratory problem with a bag valve mask, with O2, with a King airway, until we decide to treat this overdose and reverse its effects on the body. We also want to look at, our environmental clues, consider, our scene safety. This patient, we'll also check a blood sugar and treat that accordingly to help rule out that it's not a low blood sugar problem. Up at the top are just some common opioids out there: morphine, methadone, hydrocodone, heroin, oxycontin, Vicodin, fentanyl. All of those would be reversed with some Narcan. So doing intranasal medication administration, each nostril has a max of 1 ml fluid, and you give half of your dose in each nostril. So your classic, again, being Narcan. This comes packaged in 2 milligrams in 2 mLs, and our dosage, we'll just say we're going to do 1 milligram would be our dose, which would equal 1 milliliter of fluid, which would in turn equal in each nostril. So we're going to give 1 milligram is going to be the dose we choose, which, because of the 1-to-1 ratio, is 1 ml of fluid, and in turn would be half milliliter of fluid in each nostril. Okay, we've confirmed this is an opiate overdose. Our crew is going to ventilate our patient while we get our equipment ready. And like every other medication we administer, patient, medication, dose route, time, check the expiration. In the setting of a respiratory arrest opioid overdose, you don't have to worry about allergies. There are any contraindications, check the clarity and color of your medication. So Narcan, again, comes 2 milligrams in 2 mLs. Take your medication, and you have there's various atomizers out there. Just got to screw it on. So like we did over here, we're going to give half ml of fluid in each nostril, being 1 milligram total. So cover up one nose or nostril, put that in the other nostril, administer your medication, half of in one, half in the other, and then continue to ventilate your patient. After you administer your medication and you go back to do your documentation, don't forget the patient's name, the medication, the dose route, time. This is a protocol-driven procedure, and your name as the EMT.